So welcome back, everyone. I got a newbie. With me. I have with me Jason Lochinger, and he is the owner of Interim Healthcare of Gilbert. He also has with him Robin Weis, who is a client service specialist. Welcome to the show. I want you to tell everybody a little bit about yourselves, but what you do. Get right up on those mics.
Sure. All right. Thank you, Carol, for having us. Yeah, so we run Interim Healthcare of Gilbert. Interim Healthcare is actually a national organization that provides home health care. They're based out of Florida, and they have about 300 different agencies throughout the U.S. and the U.K., and we're responsible for the one that really offers services in the Greater Valley area.
Now, you have with you Robin Weis. Robin, tell us what you do there and why you are here.
So my role there is I do all of the home care. I go out and I see our clients. I do free assessments. I hire all of our staff. I do the training. So I make sure that we really have compassionate staff for our clients.
Now, I want to talk a little bit about people want to live in their homes. They want to be in their home. They want to stay there as long as they can. You said that you've got two offices. One is in Mesa, the other one is in Gilbert, but that you service the entire valley. You do free consultations. Is that an assessment that you do? Can you talk a little bit about that?
Sure. So Robin will probably add into this. So we do in-home assessments. So what happens is somebody gives us a call. A lot of times it's the adult children calling for their parents. And they're saying, Mom and Dad really need some help. What can you do to help? They'll call us and we'll talk through some of our services, what we're able to do. And then it's really critical for us to go out to that patient's house, see that patient, make sure that it's a service that we can provide and help them. One thing that we're now also offering are virtual consultations. And it's not a replacement for in-home, but it's a supplement. So if you're not ready to have us come out and meet you in your home and you just really want to learn a little bit more about our services, we want to see you. So we'll do a Zoom meeting, a Teams type of meeting, and be able to talk about that conversation. Be able to talk about what your patient needs and what we can do to help.
A lot of people wait till the last second, right?
Yes. Do
you find that it's always when the fire has happened, right? And they really should, do something early. When is the best time for them to call you?
You want to share?
Yeah, a lot of the times the best time to call is, if a family member is going to see mom or dad and they're noticing, their laundry's piling up, they haven't changed their clothes in 3 days, the food in the refrigerator, is starting to get old, start seeing these signs. That's a really good time to really start looking and to see what's out there.
Well, I think it's really important to definitely have this done early and not be scrambling at the last minute. Their phone number is 602-607-0277. They're rated with the Better Business Bureau. They do free consultations. And what's your website?
It is interim.com/Gilbert.
So interim.com/Gilbert. I want to talk about what makes you different.
So really what makes us different is the Interim Home Life Enrichment Program. Okay, so this is a program where it's a holistic, patient-centered care system that addresses mind, body, spirit, and well-being of the individual. So a lot of home care agencies, all the home care agencies provide excellent service. You really can't go wrong. There are so many caring people in this industry. But we take a different approach. We take an approach where we work with the medical doctors, we work with the other agencies that are helping that patient in order to put a program together in order to be able to help that patient.
I love that you do that. I think that's awesome because, if you're working, if you don't, what's going to happen is they're going to come home from their doctor, they forget what they need to do really.
Right.
They may get a little bit of paperwork and might say, well, they should do this. But with you working hand in hand with them, they will do this correctly. It's like, right?
Right, so a lot of times what we'll get is an order from a physician. And so here's an example. So we'll have a patient that's at a rehabilitation or in the hospital and they're being discharged. They need to go home, but they have orders from the doctor that they need to follow. And then they'll choose a home care agency like us, and we'll be there from the hospital to get them home, to make sure their home is safe, get them set up, and be able to follow those doctor recommendations, such as hydration. It sounds it's really kind of a simple thing, but our caregivers will go through and make sure that they are getting enough water throughout the day. making sure they're taking the medication on time and following those doctor's orders.
Well, I love that you do that, and this is something that you put in your phone, because you never know when, if you've got an elderly parent, believe me, when it happens fast. So be on top of it. Their phone number is 602-607-0277. It is interim.com/Gilbert. They read it with the Better Business Bureau. I say it starts with that consultation, and even if they want to start with that on Zoom if they like, or doing that virtually, but then having you come in, doing the assessment is so important. Do you agree?
Yes, absolutely.
Yes. So, okay, I want to talk a little bit about how you prioritize your patients, and so that they are cared for and they're satisfied.
So the patient care. You want the patient care?
So how it really starts is we go out. Jason and I will go out together. We go see a family member. We see the client, and we really we talk to them. We find out their personalities. We find out through what are their needs, what are they not getting by being home alone, listening to the family. And during that time, I'm also paying attention to their personality, their surroundings, because I'm already starting to think of a caregiver, because I need to find a caregiver that is going to match them.
Absolutely. But also they want to hear about your caregivers. Tell us a little bit about what they go through to be able to work with you, because that's also, you're bringing them into their home, so they want to know they can trust them.
So our caregivers go through a lot of training. One, they have to have an Arizona fingerprint clearance card. They have to have their TB. They need to have a valid driver's license, car insurance, because they are driving our clients to the doctor's appointments, to the grocery store. They are always, I'm always in contact with them. I'm in contact with the clients, the family members, doing great communication, because that is how I create that care plan, which changes all the time as well.
I'm sure it does, because their life changes and their medicine and all that changes on a dime every day.
Absolutely.
Absolutely. Now, I want to talk about how the cost is taken care of, because that's important.
Sure. So, well, first of all, with the care plan, there's a lot to this 4-page care plan. So things we provide, bathing, dressing, grooming, monitoring, medication, all that goes into the care plan. So that's why we like to have maybe a Zoom conversation, but definitely in person, where we go through that care plan to understand everything that's needed. So the financial piece of it, the cost is, there's just a couple different ways that people pay for home care services. One is through long-term care insurance. So we take like John Hancock and Blue Cross, as well as various long-term care insurances. If you have a long-term care insurance program, give us a call, and we're very good at getting certified by that insurance company very quickly. The other way is through really private care, and most patients, what they do is they have the adult children calling for their parents, so they share the cost, and that's how they're able to get that parent the services that they need.
Well, I think what makes them different, and I think it's fantastic what they do, they work with your doctors along with you. Correct?
Yes, absolutely.
I think that's huge. That makes a big difference. Also, with what you do when you come in and you do that assessment, which is so important. Yes, you can have one done over Zoom to begin with, but then they're going to come in. You've got to be able to go in that house, see what's going on, you're going to be able to assess that situation, and then make sure that they have the correct caregiver for them.
Right. We need, actually, one thing that we do is we look at the home to make sure it's a safe environment for that senior or for the pediatric, because we help children out as well. So we'll go around and look at throw rugs or how they enter a tub. We need to make sure that that person is always safe.
So not just seniors.
No, we have one patient that's 22. We're working on some pediatrics.
So somebody may need to be home no matter how old they are. They've got an accident, they're now at home,
right.
They need caregiving. So this is something that when you hear this, maybe it's you, maybe it's someone that you know. Put the number in your phone. It's 602-607-0277. They have 2 locations, which is Mesa and Gilbert, but they work the entire valley. They do free consultations. They're rated with the Better Business Bureau. You can check them out on their website. It is interim.com/Gilbert. What would be your final words today?
We provide services in home, but we also provide services at facilities. So there's short-term facilities, independent living facilities. We provide help in those areas as well as medical staffing. So for large hospitals, we provide their RNs, their nursing, their contract staff. We're able to help and provide those type of staffing as well.
I think it's great because you know what? These are the people that you need to call to get the resources you need and to find the correct caregiver for you. It's 602-607-0277.